Systems Conference, and I heard Dr. Lance Price, who's a microbiologist and the director of the Antibiotic Resistance Action Center, proclaim that antibiotic resistance is of critical importance, second only to climate change.
This issue of antimicrobial resistance and microbial overuse and thinking about antibiotic use is one that I really live and breathe every single day. I have had a number of patients who have had very severe blood infections, bone infections, and when I look at the resistance profile about the available antibiotics that I can use from the microbiology lab, there are none.
Most of the antibiotics that are in use today are based on scientific discoveries made over 30 years ago. We have not seen a new class of antibiotics in quite some time.
In the 3 years that I've been the co-leader of our antibiotic subcommittee, I can only think of 2 antibiotics we have added to our formulary, and those are both within existing classes of medications.
At the same time, we have seen a sort of exodus of companies developing antibiotics. The 2 primary challenges are scientific challenges, the science is hard, and economic challenges.
We know we have to think of a new system for developing antibiotics. I think some of the key principles for how we're going to do it in a comprehensive way, number 1 is public financing. The R&D incentives, they should be targeted, right? That's the second piece, to where we actually need to develop new drugs. And then the next thing, which I think is really interesting, because there's so many different ways that people are thinking about doing this, it's delinking. We need to separate the investment that companies make in R&D from their revenue based on, sales volume.
In the United States, 70% of medically important antibiotics that are sold are intended for use on food animals.
There's an increasing effort to reduce antibiotic use in food-producing livestock.
And I believe that the FDA recently announced a strategic plan to combat antimicrobial resistance. I just wanted to hear if any of you are familiar with the plan and any perspectives, hopes, or skepticisms regarding that plan.
They did a good thing, which was they eliminated the use of the drugs for growth promotion, making animals grow faster on less feed.
How big a concern is it that there's something that I hear is described as a loophole, that antibiotics can still be used for preventing disease?
The loophole came in because it turns out that many of those antibiotics that were approved for growth promotion and are no longer in use for that purpose, they're still approved for what's used as routine disease prevention. So, where there's no illness present necessarily in a flock or a herd, but they know that they're likely to get sick at one point in the production process, so they dose many of the animals with antibiotics. We propose that antibiotics should only be used to treat sick animals, or if there is illness on the farm, to control a verified disease outbreak.
These policies are inadequate because it creates a massive loophole, a loophole that still allows 25 million pounds of antibiotics to be fed routinely to flocks and to herds. The growth promotion is just a very small reason for the use of antibiotics. And in this massive loophole, the FDA continues to allow prevention of disease, and that is the primary reason that antibiotics are being used in industrial agriculture. So there are several very promising policy solutions that we can implement at the federal level, and we've mentioned these throughout the evening: improving data collection, closer oversight of drug labels, phasing out routine use of antibiotics, improving oversight of veterinarians. But unfortunately, there are very good reasons to be pessimistic about the likelihood of success, at least at the federal level, for implementing all of these policies that are really good ideas and would have an impact. The biggest hurdle, in my opinion, is that dramatic changes in the use regarding antibiotics really would require disruption to industrial agriculture. And in a way, FDA's voluntary program condones the use of antibiotics for disease prevention to compensate for the stressful, the crowded, and unsanitary conditions that exist at most factory farms. And so antibiotic resistance should be considered a very high cost to the production of so-called cheap food in the United States.
What incentives do you think the meat industry should be offered in order to curb their antibiotic use? Because currently there are absolutely no incentives for them to not routinely use antibiotics?
Almost 60% of consumers in America now say that they would be more likely to eat at a restaurant if that restaurant served meat that was not raised with antibiotics. Consider the fact that Purdue says that their conventional chicken sales, they rise about 1 to 3% every year. Their antibiotic-free chicken sales, those are rising about 15 to 20% per year. Talk about building brand loyalty and brand trust. You know, you want to be the fast food company who's being out there and saying, hey, we're actively working to fight antibiotic resistance.
I would really love people to know that they have so much power in their pocketbook with the choices that they make at the grocery store and helping to advance policies that combat antibiotic overuse.
How can policymakers build on the progress that food companies are making towards responsible antibiotic use, and what lessons can they pass on to lawmakers?
There has been some state-based efforts, both in Maryland and California. Bills have been passed that ban the routine use of antibiotics on farms in those states.
What was passed in California, that is the most far-reaching policy that has been enacted. And so it's very promising because California has the third largest livestock industry in the country. And so it restricts certain uses of antibiotics for disease prevention. So that's why it's going further than the FDA. The FDA allows the use of antibiotics for disease prevention. And then what's also very promising is that it requires the California Department of Food and Ag to collect data on the sales and use of medically important antibiotics from livestock producers in the state. And so the Maryland law is similar, but it doesn't have the same data collection requirement. And then, as was also mentioned, there were bills that have been proposed, and I think PERC has been working on campaigns in various other states as well. There are also some innovative policies that we're seeing even at the city level. For example, the San Francisco Board of Supervisors passed an ordinance last year requiring the city's largest grocers, and that included 122 stores in that city, to submit reports to city officials of the supplier's use of antibiotics. And we're also seeing attempts to utilize procurement policies, which can have a huge impact. So for example, the LA Unified School District became the first large school district to serve only chicken that's raised without antibiotics. And so in doing so, it approved $50 million in contracts. So that can have a big impact. So although the limitations of federal policy are discouraging, the successful initiatives that are underway by cities, by states, by consumer advocates, and the food industry exemplify how we need a multifaceted approach to address this issue.